Hi everyone, I'm Dr. Krista Burris and I'm here from Coachella Valley Direct Primary Care. Today is June 16th and we're going to talk about what's going on with Coachella Valley's coronavirus situation, as well as sort of some new information regarding the Delta variant and the state of things in California since yesterday when we did away with a lot of our restrictions and the tier system is gone. So, yay! I'm sorry I'm a little out of breath. I was running to get here, but we made it. And so today we're going to start with our first slide, which is on the District 4 report for the last week. And I put this up just so that people could take a look. As we've been looking at this over the past year, you'll see that our numbers have stayed quite low. And our hospitalization rate in the valley is hovering, sort of averaging around 10, with just 1 or 2 in the ICUs. We did not have any deaths in the Coachella Valley this week, which is good. We still are experiencing a few deaths, but right now our rates are really quite low. And if you go down, our positivity rate is still at 1.5. The county is remaining quite low. I believe the county itself is around 1.1 or 1.2, and our case rate is under 2. So I think we're at 1.5 cases per 100,000 right now, which is great. If we were still on the tier system, we would have qualified to go down to the yellow tier now. But since we're not, but that'll just give you an idea of where we would have been if we stayed there. So overall, it does look like our numbers justify removing a lot of the restrictions. And I want to kind of talk about, whether or not we think that's a good idea, whether there's some dangers with it, or whether it's totally time and it's past time to kind of get on with things. So let's go to the next slide. This next slide is looking at, can we do the one from, that one. So this is our vaccinations in Riverside County. And what you'll see here, if you go down to the bar graphs at the bottom, is that we've got about 43% of our county population over 12 who's fully vaccinated. And that's really pretty good. I mean, honestly, I'm happy with us. We've made a lot of progress over the last couple months. And about 51% that have at least one shot. And so you'll see there's still about a 7% gap in there of people who have not yet got their second shot for whatever reason. However, that still leaves, if you look at that, about 50% of our population who's not protected. And that comes in a little bit to our discussion about whether we need to worry about variants down the road or not. So let's go to the next slide. This slide, I want to draw your attention towards the bottom. And this is going to show us the percentage of people who have been vaccinated by age group. And if you look at the very left-hand bottom, you'll see that as people get older, a larger percent of that age group has been vaccinated. So in our population that's over 65, we've got a whole lot more of those people vaccinated percentage-wise than our population who's in their 20s, for instance. And again, down into the teenage years, we've really just started vaccinating that group, but we don't see a big uptake in people wanting vaccine for their teenagers. And that may come back to haunt us down the road. Remembering that coronavirus is most lethal in our oldest population, but it still does pose a significant risk for hospitalization for younger people, and we do start to see the mortality rate go up in the late 40s and mid 50s, especially in people who have high blood pressure or diabetes or are overweight. So there is a large part of our population who is in that vulnerable group, and we can see from our vaccination rates that we have more than half of those people are still unprotected. So let's go to the next slide. And this next slide here is a chart that talks about some of the variants. And in the news recently, you may have heard new terms like Delta variant or Beta variant. And what happened is they decided they needed a new name for things, because up until now, mostly what you were hearing were things like the British strain or the South African variant or the Brazilian variant. If you were a scientist, you were using the lineage nomenclatures, so like B117 or epsilon. The epsilon strain is B1427, for instance. So that's not really very useful in general public discourse. But they also wanted a different name for things that wasn't associated with a place. So therefore, thinking that something is Brazil's fault because it developed in Brazil and calling it the Brazilian flu. So same thing with the Spanish flu. It just sort of became called that, but it wasn't really originating in Spain. So most of the time, these have been identified and the strains come and go, and we haven't been too worried about them. But every now and then, we find a variant that is more dangerous. And in the World Health Organization and CDC system, there are 3 different classifications of these variants that we want to pay more attention to. The first is called a variant of concern. And this is a variant that may be a little more transmissible or may not respond as well to the vaccine or might cause a little bit worse of illness. And so that is where we see the Alpha variant, which we originally called the British variant. That was the one that first worried us in this course. And then the Beta variant was the South African, Gamma was the Brazilian, and Delta now is the name that has been given to the Indian variant, or the one that caused so many problems in India. And Delta is probably the variant that's been of most concern because it has 2 features that make it a little more bothersome. One is that it's significantly more transmissible than the Alpha variant, which was the British variant. And the Alpha variant was already more transmissible than the original variant. So this means, we started out with a bug that could get transmitted pretty easily. And then we got one that it didn't take very much exposure at all to get it. And now we have one that's even like about 80 times more transmissible, meaning all that social distancing doesn't work as well. So you're standing 6 feet apart and somebody, whistles your direction, and you might get enough virus through that interaction to actually catch it. So that just means that it's going to move through a population more, it's going to infect more people, and it's going to replace the current strains with itself. Now, if that particular virus was more transmissible but less deadly and caused less disease, that would actually be a good thing. Unfortunately, this one looks like it's at least as deadly and some data has shown that it's putting about twice as many people in the hospital. That was published in the Lancet, but there's still some disagreement or questions about whether that data is going to be borne out in future studies. So maybe it might actually be worse. So here in the United States, we've still got at least half our population, in some places more than half, who have no protection against any of the variants. But now we have this Delta variant that's doubling in the United States every 2 weeks. We went from 0.6 to 1.5% of our strains to 2.5%, 2.9%. So we're close to 3%. And in 2 weeks, that's 6%. In another 2 weeks, that's 12%. In another 2 weeks, that's 24, then 50, then 100. So you can see how it sort of logarithmically takes over. And if you go out the 2 weeks that takes, that's another month and a half. That puts us towards the end of summer, going into fall, where we now have this dominant, much more transmissible, possibly even more serious variant taking over in the United States and possibly causing us problems this fall. At the same time, we've rolled all of our restrictions back. In California really is probably the last of the states to do away with a lot of this. So in the United States, we've kind of decided this whole thing's over. And so it's kind of, I think we're in this false sense of security, like, oh, we're good. And honestly, I don't think even if we see a surge this fall, it's going to shut the economy down like it did before. But I do think we're going to see a significant number of deaths. The thing that I think is really good news is that the vaccines we have are effective against this Delta variant. And so we have the tools we need to prevent those deaths in the fall. And it's just vaccinating more of our population, honestly. And right now, I think we should really be focusing on vaccinating our younger people. Our people in their teens, 20s, 30s are the age groups that we've got a long way to go. And so maybe it would be easier to capture 20, 30% of our population that way. So that's that. What are your thoughts on, are we making a mistake? Are we vaccinating fast enough? Is this all fear mongering? What are your thoughts?
Well, the vaccination rates are the vaccination rates. I don't think overall we can say we haven't, as a nation, tried to do it. I mean, yeah, we could have done things better, but it's not like if you wanted to go out today. I mean, I had a friend who's like, oh, yeah, my wife and I decided to get the J&J vaccine. So I contacted vaccine.info, got the information, said this is where you can go. They walked in and got it. So it's not like it's a huge barrier. So, but I do think it's not going to shut the overall economy down, but there are going to be places and cities that it will shut down because the virus is a virus that is going to hit the United States unevenly. The places that are more protected for whatever reasons from vaccination rates to they're just in the middle of nowhere, will be less hit than those places that aren't. And it's not so much the death; it's just kind of the total burden of the new strain, right? So even if you get it and you're not as sick, what is it going to do to you, right? What is long COVID going to do? And that's, the other question we don't know. And I do think the deaths are probably logarithmic, meaning that, we just reached the 600,000 death mark on Tuesday of people. So, I don't think it's going to be half. I think it will be lower because it's that number is logarithmic, but it'll probably be in the 100,000s if this new variant takes a hold of certain places. So I do agree with you that probably now the younger population needs to get vaccinated, because they're the ones that are out and about more. And when's the last time you and I went to a party, right? Or we go do movie theaters, we do dinner, but not groups of 40 or 50, and so schools and stuff like that. So
yeah, I think there are a couple different approaches from a vaccine public health perspective to protecting your population. And one is to try and vaccinate the people at highest risk, and that's where we started. But the second approach, and it's actually sometimes more effective than vaccinating your high risk population, is to vaccinate the people that infect the high risk population. And usually that's children. So in some countries, they don't vaccinate their elderly for flu, they vaccinate the school children. And that's actually really, really effective at preventing deaths in their older people. So I think that is our Achilles heel right now is our number of young people who aren't vaccinated, the fact that we still do not have any vaccines that are even emergency use authorized in younger children. And I think the predictable reluctance maybe to vaccinate school-age children without more time. I think that's probably what's going to play out. So I do think we'll see a bump. It's just hard to predict at this point how big that bump will be, how significant it will be, and whether, if we start to see a bump, if that'll spur another vaccination push, and then maybe we'll actually be able to vaccinate another chunk of our population when that surge comes. So we'll see.
Right, because I think this false sense of feeling like, oh, I'm good, half the people are vaccinated. So now you have a more contagious strain, and there's only half the amount of people that it can affect now. So the chance of someone getting that, like, we're vaccinated, so our risk is very low, right? If we're in a group of 100 people, we're not going to be the ones that probably get affected by this new strain. And so I think we want to tell people, if you're unvaccinated, your risk of getting COVID is no different than when it started in the first place, and actually it's probably higher because of this Delta variant. Wouldn't you agree?
Yes, I think, in general, it's lower right now because our transmission rates are low, but as we've seen, that can sometimes change very quickly. So it takes some time to develop that immunity from vaccination. So this is really the window, our last window for people who have been just sort of waiting to get vaccinated before fall.
Right.
So I've been trying to encourage people who've been sort of holding out a bit just to kind of go
right.
for it.
And then there's the winter where then most of the country goes indoors. We go outdoors, but
right.
That's going to be a problem too. So
okay.
So we probably should get to our other show.
Yeah.
So thanks for joining us. Definitely, we encourage everyone, if you can, get vaccinated. If you have any questions, please talk to your provider. And we hope that the vaccination rates go up. And we thank you for joining. And if you have any questions, please post them and we'll answer them as best we can.